eDoc4u is committed to inspiring clinicians to provide better health in a more efficient and engaging manner for their patients. The first of many problems eDoc4u addresses is the time-consuming capture of Medicare health risk assessments by automating the requirements with secure bidirectional integration with Allscripts. A patient arrives for his annual Medicare Wellness Visit, and the receptionist provides him with an iPad that is automatically preloaded with his health information. The patient starts the health risk assessment by entering his privacy PIN and is now ready to complete his assessment in just a few minutes. Making broad use of Allscripts' Unity framework, eDoc4u provides secure and real-time data extraction from the Allscripts EHR. This patient-specific data is populated into the eDoc4u health risk assessment to increase accuracy and speed up the assessment process. eDoc4u collects his information with an easy-to-use interface that intelligently evaluates responses as it learns about him. There, we're finished and ready to see the clinician. eDoc4u provides evidence-based solutions at the point of care, delivering assessment results to the Allscripts EHR for efficient access by clinicians. From within the Allscripts EHR, the clinician opens the patient's eDoc4u note. This patient has pre-answered Medicare Annual Wellness Visit questions that allow for a meaningful and efficient review with the clinician. This patient is at high risk for heart disease, and a personalized prevention program is prioritized for his completion. He is due for a colonoscopy, and his previous cholesterol panel exhibited values that were out of range. His BMI is elevated, and diet and exercise are concerns for discussion. The clinician recommends he use eDoc4u's Personal Health Manager to complete the assigned programs, while the clinician monitors his progress and will be in touch. After a successful visit, the patient and the clinician conclude their session, both with a sense of accomplishment. Patients are typically not engaged with clinicians in ongoing programs to improve their health. eDoc4u creates a new paradigm. Patients can securely log into their eDoc4u account whenever, wherever, and on whatever they choose. eDoc4u's Personal Health Manager automates participation in disease management, preventive care, and healthy lifestyle programs, empowering patients to better manage their conditions and modify unhealthy behaviors. The Personal Health Manager supports ethnic, cultural, health literacy, and disability challenges. Self-management programs are selected and prioritized by eDoc4u disease risks and include streaming videos, content, and recommendations specific to their needs. 32 unique programs are currently available. eDoc4u not only impacts patient engagement, but it delivers significant improvements to clinical productivity and compliance management in a deeply integrated Allscripts partnership. Clinicians can access eDoc4u's disease and prevention registries from within Allscripts that are automatically populated in real time, with Allscripts codified patient data to show those patients with the greatest gaps in care. Through eDoc4u's disease registry, the clinician creates prioritized tasks and performs outreach messaging for patient engagement at an individual level. Or the eDoc4u platform can automate assessment and campaign message delivery. That's all it takes. Patients need to be proactively engaged in their own health, and sometimes they need reinforcement. Patients receive reminder emails from eDoc4u that support medical compliance requirements. Clinical notifications identify opportunities for health improvements, and patients can follow up on items flagged by their clinician. Supported by real-time data from Allscripts, the patient can also review their dashboard, access health awareness programs, take action on health reminders, and request follow-up from their clinician. Patients may also take a brief satisfaction survey that supports meaningful use requirements. Clinicians need a more productive workflow for patient management to improve their outcomes. eDoc4u automates that. Patient participation, progress, and compliance are communicated from eDoc4u to Allscripts. This information is communicated to the clinician via the Allscripts task message workflow to improve outcomes and comply with meaningful use Stage 2 and 3 requirements. Today, this patient is meeting with her clinician to follow up about important tests and recent conclusions drawn from her engagement with eDoc4u's Personal Health Manager. She is a diabetic and now has a better understanding of the complexities of this disease state. Armed with this information, she is more effective at dealing with and working with her clinician to better manage her condition. eDoc4u improves clinical productivity, patient engagement, and compliance management.